The patient I'm with today is Mr. Gates. He is a 65-year-old male who stands at 68 inches tall. He is a post-operative patient. He had upper abdominal surgery. He's at risk of atelectasis, so we're gonna put him on incentive spirometry, help with the expansion of his lungs, prevent the atelectasis from developing. So I will introduce myself to the patient, tell him who I'm with. So my name is Paxton. I am with the respiratory department. Um, we're gonna teach you how to use the incentive spirometer, so that we can prevent the collapse of your alveoli, which is where the gas exchange occurs. So what we're going to do is the spirometer comes with a little chart here, and it has both male and female. So he is a male, so 65, 68 inches. He will want to reach 2,400 milliliters. So we'll adjust that here. It'll be right about there. Doesn't really show, but and then we'll instruct Mr. Gates on having him exhale fully, and then have him seal his lips tightly around the mouthpiece. That way, we can make sure that all the air is going through, that he's reaching the point we want him to. And even if the first few times he reaches halfway, that's fine, as long as he is getting up to that max mark. So, as he's exhaled, his mouth sealed completely around it. So, as he is inhaling, nice slow inhale, until basically until he can't inhale anymore. Try to keep it at the have him know that the best mark is where we would like to keep it. A little float here. And once he has reached that full, the peak of what he is comfortable with doing, have him hold that breath for 3 to 5 seconds. A good way to have them remember, if they can, that once it reaches the bottom here, is when they can exhale. That way, that is the important part of this treatment here, or this therapy, so that it expands the lungs, the alveoli. And as soon as he is reaching close to where he should be, might be able to be on his own, and checking on him he can do this 60 times per hour. So once he is able to do this on his own, check on him every few times he does the spirometry, make sure everything's going well, check his vital signs, listen to his lungs and everything of that sort, making sure everything is working how it should. Everything, you can instruct the patient to cough, which will allow us to observe anything that has been expelled, so any sputum production and stuff like that.